Well, meanwhile, as COVID-19 vaccination programs start to pick up across the country, immunocompromised Canadians say they are not being prioritized for vaccines. Now, some advocacy groups have been asking provinces for higher priority access because of their high-risk status. And for more, we're reaching out right now to Dr. Stephen Betschel. He is the co-director of the Medical Advisory Committee for the Canadian Immunodeficiencies Patient Organization, also a clinical immunologist and allergist at St. Michael's Hospital. So, Dr. Betschel, thank you for joining us today.
Pleasure to be here.
Listen, I want to begin with this letter writing campaign that your organization has started. It's essentially asking provinces for priority access to vaccinations. Have you had any success so far?
That's right. So we have, and I just want to put it in some context. So patients with primary immunodeficiencies are somewhat rare and often missed in terms of the prioritization. So our organization has raised awareness by generating letters to the ministers of health across the country. And there has been some traction, and some provinces have picked this up. Most recently, Ontario, a few days ago, have prioritized immunodeficiency patients in that group. Other provinces either have not prioritized them or made it clear what other groups would be prioritized. So we have had some traction, but there is still some ways to go.
Okay, some ways to go. Let's go back a little bit, though. You say it's a rare grouping. What do you mean by that? What conditions are we actually talking about here?
That's right. So the Immunodeficiency Patient Organization focuses on patients who have primary immunodeficiencies. So immunodeficiencies that are inborn or genetic in most cases, congenital. And many of those, and many people who think of immunodeficiencies think of children. The majority of patients are actually adults who have underlying primary immunodeficiencies that make them susceptible to infections and susceptible to severe outcomes. And we know these patients, should they contract COVID, are more likely to have more severe outcomes.
So what has this pandemic meant for people with primary immunodeficiencies been like? What have they been living with during this past year or so?
Sure. As you can imagine, everybody's quite anxious, but particularly those who are susceptible to severe infections, who have immune systems that may not respond to those infections. And the anxiety level has been extremely high. It's extremely high because they're also at risk with the people they live with or the people they're in contact with, because they are at risk of bringing the infection home. And unlike other groups who are prioritized and will be immunized, they will likely mount an appropriate response to immunization. The group of immunodeficiency patients may mount some response, but not a full response. So we really want to raise awareness, not just to immunize the patients who have the immune deficiency, but also those who are in closest contact with them as well.
Now, are there other countries where immunocompromised people are actually given priority access to vaccines?
So the one that I'm aware of is the UK, who's at least stratified risk groups that have included immunodeficiency patients in that group.
So what would you like to see here then, in terms of where people with primary immunodeficiencies fit within the vaccine rollout schedule? What would you like to see happen here?
Sure. I think what we'd like to see happen is that all provinces identify primary immunodeficiency patients as high risk, and that they address that to bring them into the forefront of the groups who should be immunized early. What I'd also like to see, and it may be a little bit late for this, but the risk to primary immunodeficiency patients and other groups who are prioritized are similar across the country. But every province has different phases or groups to which they're trying to lump these patients into. And that just leads to confusion and furthers the anxiety amongst an already anxious patient population.
And talk to us about the anxiety that you're hearing about right now.
Sure. I think the anxiety, many people who have immune deficiencies may be out in the workplace or would have been out in the workplace. People are starting to transition, and as things start to open up again, either they themselves are being expected to go back into that workplace, or the people they live with or in closest contact with are going out into those workplaces without possibly access to vaccines, and that just increases the anxiety even more.
Well, Doctor, I want to thank you for raising the issue with us today. Thank you for your time.
My pleasure. Thank you very much.
And that's Dr. Stephen Betschel, clinical immunologist and the co-director for the Medical Advisory Committee for the Canadian Immunodeficiencies Patient Organization.